Okay, so I wanted to share some brief information to tell you all about the vagus nerve, the importance of it in the gut-brain axis when you're trying to resolve things like chronic pain, chronic digestive issues, and get your body out of that stressed fight or flight response and down into the rest and digest, and to give you some tools and strategies to do that. So the vagus nerve is one of our cranial nerves, meaning it comes from our brainstem up by our brain and goes to different areas of the body. In this case, there are two of them. Start on each side of the brainstem. They're connected to part of the ear, and specifically the part of the ear known as the tragus, T-R-A-G-U-S, into the back of the throat, the pharynx and the larynx. When you go ah or you're singing, your vagus nerve is activating. It goes through the carotid arteries in your neck. You can see when you can feel that pulse on the side of the neck, those are the carotid arteries, and it goes down through all the major organs in the abdomen, the heart, the lungs, but most especially connects to your digestive system, stomach, pancreas, liver, and the intestines. And it connects to the enteric nervous system. The enteric nervous system is all of those nerves that are in the digestive system. There are so many nerves down there that in the anatomy and medical world, have started to call that the second brain, because outside of the brain, it has more nerves than any other area in the body. The ENS helps to coordinate digestion, and we need that vagus nerve connection between our brain and our gut to support that process and promote the parasympathetic rest and digest. So how do we activate it? Well, there are many different ways now. We actually have some good research evidence to show. You can do belly breathing. This is breathing through your diaphragm. A lot of us that are very stressed or work at a desk all day tend to breathe through our chests and our shoulders. So a way you can see if you're belly breathing, breathing into your diaphragm, is to place one hand on your belly around the belly button and one on your upper chest, and to take a couple deep breaths. Let's do three of them together. Breathe in and breathe out. Breathe in and breathe out. And breathe in and breathe out. So during those three breaths, most of the movement you felt should have been in your belly or down from the bottom of your ribs into your core. That is what we call diaphragmatic breathing, breathing through the diaphragm down into the belly and your core. There should be little to no movement when you're relaxed anyway in the upper chest or the top of the shoulders. Those muscles up there are called accessory breathing muscles, and they're to help us breathe when we're huffing and puffing, say when we're exercising. But when we tend to be stressed or we're hunching over all day, we stop breathing through our diaphragm and we start breathing more and more in our chest, which keeps us in that stressed fight or flight response. So diaphragmatic breathing can help to activate that vagus nerve and get the nervous system to calm down. Gentle exercise, especially with a mindful component, can be really helpful to activate the vagus nerve. Stretching in general, doing mindful exercise like yoga or Tai Chi, something where you're moving very slowly and intentionally and present in your body, can help to calm down the nervous system, bring you present there, activate the vagus nerve. As I mentioned before, part of the ear connects directly to the vagus nerve. This is sort of the middle of the ear, and the areas directly around it have some vagus nerve innervation as well, particularly the tragus right here, T-R-A-G-U-S. So rubbing that or stimulating it with an electrode can be very helpful to activate the vagus nerve. Some of the muscles of the neck and the upper back also connect to the vagus nerve, so massaging the neck and the upper back can help to calm down the nervous system, activate that vagus nerve, get into the rest and digest. Certain types of moderate or vigorous exercise also help to activate the vagus nerve. Although exercise itself is a stressor, when we do moderate or vigorous exercise, afterwards the body increases anti-inflammatory activity, and that can actually help to activate the vagus nerve afterwards. That is, of course, if you're doing things like your warm-ups, your cool downs, you're getting plenty of rest in between your workouts and you're not, burning out that exercise stressed system. There's also some good evidence to show that um, periods of exposure to cold, such as splashing your face with cold water, um, sw swimming in cold water, like a cold plunge, or having cold bursts in the shower, can also help to activate the vagus nerve by releasing what we call cold shock proteins that are anti-inflammatory. Some other ways include gargling tepid water. So what I'll have people do is leave a glass of water out overnight when they go to bed, and when they wake up, it'll be nice and room temperature. You can even put a pinch of sea salt in there and then gargle it. And the vagus nerve activates the back of the throat, the larynx and the pharynx. So that gargling activity helps to stimulate the vagus nerve. To really make sure you're activating it, though, you have to do it for about 30 seconds, which feels longer than it is. So I encourage you to give that a try. Get some water and a throat and just set a little timer that'll beep after 30 seconds so you can get an idea of what that's like. While you're doing it, feels longer than it is, but that'll help to activate the vagus nerve. That can be a really easy thing for you to do every day when you're winding down for the night, say when you're brushing your teeth, or to help in the morning if you're already feeling stressed before you get ready for the day. Because the vagus nerve is innervating all those muscles in the abdomen and is connected to the back of the throat and the lungs, humming or singing very loudly can be very helpful to stimulate the vagus nerve, calm down things, get into that parasympathetic state. I think about people that, were working on a chain gang or may have been indentured servants or even slaves, and just the history of the fact that those groups of people were often singing throughout the day, not just for camaraderie, but I would imagine to help keep their nervous systems together so they could get through those really trying times. So singing and humming can be really beneficial. I recommend that you do that whenever you can, even if it's just singing loudly to yourself in the shower or on your way to work. Nicotine will also activate the pathway that supports that anti-inflammatory vagus nerve. I don't recommend smoking, but I like to put it on there because it will stimulate the same receptors, and it's good to have knowledge. If you are going to use nicotine for this purpose, I, of course, always recommend things like nicotine gum or a patch rather than smoking when you're smoking cigarettes, cigars, or even cannabis. Um, those products, you're inhaling all sorts of carcinogens and metals into the lungs. It's not good for you. So I don't really recommend that. But because it helps to activate that anti-inflammatory pathway, you can see one of the reasons that people really like nicotine is it helps to calm down the nervous system that way. Acupuncture can activate that same pathway, and you can see here's a picture of someone getting some acupuncture in the upper back, where we know that there are some connections to the vagus nerve. Certain herbal medicines can help to activate that. We're not going to go too much into that here. That's sort of a different subject, but no, there are a variety of different foods and herbs, and even some probiotics you can take that will activate the vagus nerve. Heat exposure is another way to do that. I always recommend something like a sauna or sauna if you're Finnish, especially an infrared sauna that will get you a lot of those same benefits without using as much heat. A steam room can also be helpful for that as well. That produces heat shock proteins, which, similar to the cold shock proteins, are very anti-inflammatory. Now, if you want to activate the vagus nerve directly, there are various electronic devices that you can buy that will stimulate that. Most of them go on the ear, like around the tragus, you can see in this picture here, or on the carotid arteries, stimulating that vagus nerve directly. Those can be expensive. So, and of course they require, regular use so that you can actually get the benefit, like doing it every day for a period of months to see if you feel a difference. They can be helpful but expensive, so I always recommend trying these free things first and see how that works for you. The more of these additive things you can do in your daily life, the better off you will be. Most of us in the modern world are chronically stressed out, and ideally, we would be in that parasympathetic rest and digest nervous state about 80% of the time. And for most people that I work with as a functional medicine doctor, chiropractor, nutritionist, I'd say it's almost the opposite, where people are in that sympathetic fight or flight 80% of the time and rarely get a chance to activate that vagus nerve and calm the nervous system down. These are the references if you are curious. And if you are curious about learning more, please subscribe. I do a lot of regular content on nutrition and lifestyle medicine. and feel free to reach out to me if you have more questions.